So welcome all to this webinar organized by the Canadian Association of Midwives, during which we will present you a 30-minute documentary. Voice, Choice, Change, The Lives of Midwives offers an intimate glimpse into the lives of 4 very different and complex women in South Sudan and Canada. We follow the midwives as they negotiate a diverse array of personal and professional challenges, going from difficult births to coping with non-existent resources, to the ongoing search for respect in their respective midwifery practices. The documentary features Kunda and Scovia Nalumu, 2 UNV midwives based in South Sudan who struggle to save lives of women and babies in the nation with the highest maternal and infant mortality and morbidity rates. In Canada, we spend time with Jenn, Nguyen, and Susanna Koo as they follow young families with difficult birth processes while speaking about advocacy, empowerment, and shedding light on the realities of working in a profession that few people understand. Voice, Choice, Change explores the deep-rooted relationships midwives have to their profession, their clients, to other women, and to their communities. The film was shot by videographers Charles Atiki Lomodongo in South Sudan and Chloe Ellingson in Canada as part of the second phase of Strengthening Midwifery Services in South Sudan project. The main objective of this project is to reinforce midwifery services in South Sudan through education, peer-to-peer training, and association strengthening in order to reduce maternal and infant mortality while providing support and resources to empower women in their reproductive rights and health. The project is implemented under the leadership of the UNFPA in collaboration with the Canadian Association of Midwives, the South Sudanese Nurse and Midwives Association, the South Sudanese Ministry of Health, and other stakeholders in South Sudan. It's funded by the governments of Canada and Sweden. So here is the documentary. Thanks. Enjoy. I hope that you've enjoyed the screening of this documentary. Now, I would like to introduce you to the 4 midwives that we follow in the documentary, and 3 of them are with us today, so you will have an opportunity to ask them questions. Donc, je commence par Susanna Koo. She was born in Peru, and she's of Chinese-Peruvian descent. She graduated with a degree of midwifery from the La Universidad San Martín de Porres in Peru, and completed her studies in Canada at Ryerson University in Toronto. She currently practices midwifery full-time in Sarnia. As a young girl, she developed her passion about women's health and childbirth, which became stronger when her youngest brother was born. Dora Kunda is a midwife currently based in Wau in South Sudan. Dora became a midwife after seeing too many women in her community die in childbirth due to a lack of skilled health attendant in her country. The death of her co-wife still affects her deeply. She completed her midwifery education at Wau Health Science Institute and began working as a UN volunteer shortly after. She's a dynamic advocate for better health in her community, and she sees midwifery as the response to the challenge of reducing high rates of maternal and infant rates. Scovia Nalumu felt compelled to become a midwife after witnessing the death of her aunt in childbirth. Both mother and child died at that time. She felt she could make a positive impact on the lives of mother and babies and earned her diploma in midwifery from the Maridi Health Science Institute. Shortly after, in 2015, she started working for UNFPA as a UN volunteer. She's a strong advocate for her profession, and she envisions a South Sudan where there will be better infrastructure, more properly trained midwives, and more respect for her profession. Scovia is currently based in Marindi. Jenn Nguyen grew up in Nova Scotia, but she moved to northern BC when where she obtained a master's degree in community health science. Her research for her thesis allowed her to learn about health disparities in rural and remote Aboriginal communities. It showed her how much work still needs to be done to improve access to quality maternity care for all. She pursued her studies and graduated from the midwifery education program at McMaster University. In 2016, she began working with the Pomegranate community Midwives. Her main goal is that all her clients feel supported and empowered to make the choices that are right for them and their families. And I see one first question. So the question, and I don't know who would like to answer this, maybe all of you. What was the experience like to be filmed? And how did your clients felt about it? How was your approach to convince them to participate in this documentary?
I could go to first, I guess. So that question actually gives me and us, I guess, the opportunity to really thank our clients, our patients, who really gave us the opportunity to showcase the work that we're doing with them and for them. I can't thank enough, especially to Allison, the person who was actually working with me at that moment, to let me involve all this project in a very vulnerable time for her and her family. So I guess it was a mix of emotions of being filmed and knowing still that you have to, well, you're performing your work, but then you know that you're being filmed. And I was always thinking about, like, I have to be careful that my client is feeling comfortable. So I was always asking her, in this case, are you okay? Do you want us to stop? Do you want the person who is filming to be out of the room? And that's how sometimes the films are not in the house or out of the house. But of course, and I think it speaks to the relationship that we develop with our clients. And we have to be very honest, and we have to give them always the chance to verbalize what they're feeling at that moment. I'm watching at the video now, and it's very emotional. I don't know for you, Jenn, but it's been couple years now, and I'm like, oh wow, I applaud for the people that actually work on how to edit the film and all that. It was beautifully done. Yeah, so
thank you. Jenn, would you like to add something?
Yeah, sure. I think filming is weird. They're really, they're always trying to get these shots. Chloe was awesome. She followed me for 3 weeks. And I walked to clinic every day. And so Chloe just walked with me for 20 minutes while I ate on the go. And it was a lot of me saying, okay, Chloe, it's just going to be me eating now. And me driving to a home visit and then stopping to eat, and then me eating in the car and me eating in the hospital and me eating a lot because I love to eat. And in terms of client participation, I think the biggest thing that I emphasize is that they were in control at all times, just like with their care. And it's their choice. So at any time they can say no or back out or whatever, and that be no difference in their care with me. And for my client, May, whose birth was filmed, there was a piece where she was like, no more. And we were like, cool, bye. And then Chloe just like slept in the hospital for like 2 days, basically, just in case she changed her mind. So our videographers were very dedicated as well. And they didn't want to take my direction of filming more of my dog because I think my dog is so beautiful. And I wanted her to be in the film more, but she made a one cameo. So I was pretty happy about that.
Okay, I think that we've lost the connection with Dora, unfortunately. She was in a while, I think, in South Sudan, and we've lost her. Maybe she can come back. So I see another question here. What do you think are some of the major challenges facing midwives right now?
Now I want to share with you my challenge facing us as a midwife in South Sudan. One, we don't have enough equipped staff to give anesthesia. We midwife can do our part in terms like if there is obstructed labor or prolonged or it want to lead to cesarean section. Those are the things facing us. Also, we don't have qualified doctor like gynecology. The only gynecology we have here is only two with this big hospital. People used to refer from Kwajok, from other state to the same Wow Teaching Hospital. We have another challenge that we don't have a well-equipped neonatal ward like oxygen machine, resuscitation equipment, those things. Also, we have a poor of knowledge update, like training, workshop for the new updates. So also we have learned a lot of the drugs equipment being used in other country which are not here with us. We are well trained from UNFPA. UNFPA has done his part. Even the CAM also support UNFPA to train so many schools. But the problem, those are the things that's facing us.
Jenn or Susanna?
Yeah, I can speak from a BC perspective. I mean, we're in the midst of contract negotiations right now, and I know in Ontario that there's been a large, long battle with recognition and pay equity. I think in all our fields, recognition for the work that we do, equal pay is a very important thing. It's our livelihood, and it affects us in the healthcare system and our clients. So, you know, that's definitely one of the large issues that continues to plague us. And then specifically in light of the pandemic, midwives being supported in terms of proper access to PPE, to the same benefits that other healthcare providers are receiving in terms of pandemic pay, things like that. We've had in our community, we've had a huge increase in interest for home birth to stay out of the hospital in the pandemic, and we've answered that call, but with, you know, a big toll in terms of burnout and being able to find locums. And when we get exposed with COVID from a client or in the community, we need to isolate. We don't have sick pay, we don't have time off, we don't have things that other professions have in place. And so the pandemic has really shone a light on the inequities that midwives face in terms of work conditions and pay.
Susanna, yeah.
Yeah, I guess globally though, midwives have been always struggling with their space in the health system. And there must be different factors around it. It could be because we can hypothesize, like because we are a predominantly female profession, we're taking care of female bodies. But I think at the end of the day, it comes from recognizing that pregnancy, birth, postpartum is as important as checking someone's heart or detecting cancer and or so many things, because it's an event in someone's life that you really bring family together or you separate them. And then if we're talking about a global perspective, just because but because I've been trained outside Canada, I could speak on how many times, actually right now, my colleagues in Peru are struggling very badly because there is this fight against taking away all the recognition that they have gained through so many years, like 194 years of working, because that's how their profession is regulated. And by the conversations with our peers in South Sudan too, it seems to be the equal amount of disparities, the equal amount of trying to silence the voices of midwives and the people that are being served by midwives. Hopefully we will have a right answer to tackle with that concern and problem. But I echo Jenn, like, I think it's exhausting just been fighting many years with the health system, with the society, and we are quietly been working behind the scenes during pandemic. And then the biggest advocates for us have been actually our clients. I don't know how it was for you, Jenn, in your province, but when we were lacking PPE, it was our clients who were donating PPE to us because we were in the list of healthcare providers. And then it wasn't until maybe the third wave, at least here in Ontario, that they decided, okay, we need people, so let's call midwives to fill up those gaps. But in the first wave or so, we were silent. And I could speak, I think it was the same in big parts of the world.
Okay, great, thanks. So there's I think we're gonna just take one more last question here, and it has to do with the peer-to-peer experience. I think that both of you have participated to this peer-to-peer component in the part of the project in South Sudan. Could any of you explain what it was exactly and what kind of experience you gained through that component, through that participation? Explain to us how it worked and what kind of experience you gained through that.
Yeah, so Jenn and I were part of this group of Canadian midwife pairing with midwives in South Sudan. The first call or of enrollment, they were calling new registered midwives or midwives that were working in Canadian capacity within, I think it was the first 3 years of their training, right? And then we were pairing with newly graduated midwives in South Sudan. So the idea about being new into the profession is because we both groups were learning how to be a midwife at that moment. And midwives in Canada, we were supporting our peers in South Sudan with knowledge translation, sending material. Maybe Jenn can go deeper into that, but one of the biggest challenges we had, though, before the world became virtual, we were actually doing virtual work with them, and then there is a time difference as well. Well, Dora is back, so she probably could talk about it. But then we really tried as much as we could, sending information, getting in contact with them. But then through the process, we learned that there is so many challenges for our peers in South Sudan, not having reliable internet, not having access to getting into a computer, and even gender being in place. Like, I remember that most of us, we had more success getting in contact with female midwives rather than male midwife rather than female. And I learned that because of my peer is female, so she was taking care of the kids, or she couldn't walk at night because it wasn't safe for her. So all those components you really learn through the process. And I couldn't be thankful enough for the opportunity to be part of the team.
Okay. Jenn, would you like to add something?
Yeah, the knowledge translation piece of it was really, really quite interesting, because I think some people would assume like the Canadian midwife would bring knowledge to the South Sudanese midwives, but it was, I feel like, completely the opposite. I really took an interest to this program because, you know, in the hospital we have a lot of resources, but at home births we do not. And so there were so many interesting tricks and tips that I learned from my South Sudanese peers. One of the ones I can think about is a Bacri balloon. So if you're having a postpartum hemorrhage and your uterus is floppy, I don't know who is on this panel, maybe everybody knows this, but there's this device called the Bacri balloon where you place it into the uterus and it fills up to put pressure as a tamponade on the uterine wall. And one of my South Sudanese peers showed us how to do a Bacri balloon with a Foley catheter and a condom. And a Bacri balloon is like $500 for one device here. And the condom and the catheter was like, I don't know, $2.90. and just my mind, it kind of exploded. You know, it's just kind of amazing, the resources and the creativity, and you know, and our actual peers use that to save lives, and it works. So it was just I have a condom and a catheter in my own birth kit now for that reason. It was a really wonderful experience. I really enjoyed it.
So I think that Dora is back on this panel. So maybe Dora, we were discussing the peer-to-peer experience, and I think that you were also part of it. Do you have something that you would like to share?
Also, we can thank those Canadians country like those who used to support the Sanama Nurses and Midwife Association in South Sudan, because they have been supporting us with so many things. Even they support us with training, they support us with experience, even encouraging midwives and nurses to collaborate together, to work together. This is the benefit of CAM.
And I would like maybe to also mention the fact, just in case you would like to offer a financial support to the South Sudanese Nurses and Midwives Association, that we have some fundraising initiative. So SNAMA, the South Sudanese Association, Midwifery Association, in collaboration with CAM and the registered charity, the Mercy Project, launched an income generating initiative in 2019, and that was to empower 5 chapters of SANAMA, the South Sudanese Association, to raise funds that will support their activities and their members. So each chapter has started a business within their community, and the revenue raised will help to support their midwifery work. With this, through this program, each chapter was trained and to develop a sustainable business plan. Each chapter that will have completed successfully this process will be supported to start their own business initiative, and the materials that would be needed for these businesses will be purchased with the money that would be raised through this fundraise initiative. So I think this is it. I don't know if there's anything else that any of you would like to add.
I want to thank Dora so much for staying till now. I don't know what time is for them, but we really appreciate really our friends, or our friends and peers in South Sudan. They've been doing, like, I don't know how much they really are doing to save the lives of their people in their communities. And they're amazing in the way that they're working, because as Jenn said, like, they're seeing things that we don't see as midwives in Canada, like triplets, cardiac conditions, and they have to manage those things because they're the only ones working then. So if you have the opportunity to help them or to donate, please do. Assess their mothers, their fathers, their siblings, and their children also, and they're supporting their families as well.
All right. Any last words, Jenn?
Susanna said it all. Yeah, thank you very much.
Thank you. Thank you all for being there with us, and stay tuned for another webinar. Bye.